Welcome to this explainer. You know, when we hit the gym, we almost always picture our muscles working hard, our lungs heaving, and our heart absolutely pounding. But there's an entirely different, brilliant mechanism working in overdrive behind the scenes just to keep you functioning. Today, we're diving into how your body's ultimate water filters adapt when you push your limits.
Think of your kidneys exactly like that quote says, as the body's water filters. They are dialing down flow to save energy for your muscles, but at the same time adapting to keep your entire system perfectly balanced. It's wild because while we hyper-focus on our heart and skeletal muscles during a workout, the renal system is quietly managing your hydration, your blood pressure, and your overall recovery. They are your ultimate fluid managers. Here's our roadmap for today's high-yield study guide. We're going to break down everything from your body's immediate acute fluid conservation tactics all the way to its long-term structural upgrades. All right, let's jump right in and map out exactly where these crucial fluid managers sit within the grand scheme of your physiology. As you can clearly see here, oxygenated blood shoots straight from the heart, down the aorta, and boom, directly into the renal arteries. The cardiovascular system and the renal system are completely, intimately tied together. The heart pumps it, but the kidneys filter it. They're regulating your blood volume and balancing essential electrolytes like sodium and potassium. They demand a huge portion of your resting blood flow just to do this job. So what exactly happens to all of this blood flow the very second you start a grueling workout? Massive exam alert here, folks. When your muscles are screaming for oxygen, your body dynamically redistributes its resources. It literally diverts blood away from the viscera, specifically the kidneys, to feed your working muscles and your heart. We're talking about a drop in renal blood flow to as low as 25% of its normal resting value. That is an extreme, immediate restriction of resources. Which brings us to a really crucial memory aid you're going to want to keep in mind. RBF drops, GFR holds. While renal blood flow plummets, your glomerular filtration rate decreases significantly less. It's honestly incredible. Your kidneys just lock in and maintain that vital filtration to protect your system, even when their blood supply is drastically slashed. Because of that intense physical stress and blood diversion, you're going to see some immediate acute changes. Your urine output is going to drop drastically as your kidneys desperately hold on to water and sodium to keep your blood volume up while you sweat. And heads up, you might even see a transient excretion of proteins or even red and white blood cells right after a heavy session. It's a totally known acute response to that massive physiological load. Okay, but how do the kidneys chemically know to go into this extreme conservation mode? Let's test your active recall real quick. They need messengers, right? So which specific hormone is sounding the alarm to conserve water while you're exercising? Take a second and lock in your answer. If you said ADH or antidiuretic hormone, you absolutely nailed it. It surges during exercise to act directly on the kidneys and prevent excessive water loss in your urine. But it's not a solo act. It works right alongside aldosterone and the renin-angiotensin system to lock down your hydration and electrolytes the second your body realizes you're sweating buckets. So that's the immediate survival mode. But what happens structurally over time if you make a habit out of hitting the gym? Time for another quick quiz to keep us sharp. Think about the overarching effects of fitness. What would you say is the single most significant, long-term renal benefit of consistent physical training? Pause for a second. Here comes another huge exam alert. It drastically improves your blood pressure regulation. Consistent exercise lowers your resting BP and makes your vascular system way more elastic. That acts like a literal shield protecting the delicate blood vessels inside your kidneys against the development of chronic kidney disease. And those chronic structural upgrades don't stop there. Regular training dials in your metabolic profile by helping control blood glucose, which takes a ton of strain off the kidneys. Plus, you get a massive boost in systemic antioxidant capacity to heal acute injuries. It's even a crucial therapy for preserving vital muscle mass in patients who are already facing chronic kidney disease. All right, let's pivot to the practical side. How do we balance these incredible long-term benefits with the very real physical dangers of pushing too hard? It's all about balancing the two physiological phases we've been unpacking today. On one hand, you have that acute, immediate need to just survive the workout, holding on to fluids, dropping flow, ramping up hormones. On the other hand, you have the chronic goal, those long-term structural adaptations that keep your blood pressure perfectly stable and protect your organs for decades. So, clinically speaking, consistent, moderate activity,
like brisk walking, swimming, or cycling, is the absolute sweet spot for kidney health. But trying to run a marathon while severely dehydrated, that is a fast track to acute kidney injury, or AKI. Your kidneys literally cannot filter without enough water. And of course, getting medical clearance is an absolute must before starting any exercise protocol if you're dealing with pre-existing CKD, dialysis, or if you're a post-transplant patient.
Let's bring this all home and lock it in.
Here's the high-yield, rapid-fire summary you're going to want to take a mental snapshot of. Acutely, your renal blood flow drops significantly. ADH and aldosterone spike, and urine output plummets. Chronically, your blood pressure control and antioxidant capacity get a massive upgrade. The big risk? Dehydration plus intense exertion leads straight to AKI, so the ultimate prescription here is moderate, consistent exercise paired with proper hydration. I'll leave you with this to chew on as we wrap up this explainer. If your kidneys can brilliantly dial back their resources to run on just 25% of their normal blood supply and still keep your entire system perfectly balanced while you're out there running or lifting, what other hidden limits is your incredibly adaptive body actually capable of pushing past? Thanks for hanging out with me for this deep dive. Keep exploring.